to show you how we use basically this analyzer to process data and to analyze data. So this is actually a subset of the data from the type 1 diabetes publication that I mentioned earlier. So there were more than 2,000 repertoires in this. We included a little over 150, if I'm not mistaken, in this analysis, where we have healthy repertoires, type 1 diabetes repertoires, and then also some samples with early onset type 1 diabetes with some early stage autoantibodies. We're mostly going to focus on the healthy versus type 1 diabetes subsets. Of course, this is a huge data set, so basic metrics like overlap look quite impressive. And the first thing we're going to look at is, do we have actually annotations for type 1 diabetes antigens in this data set? And here you see the top scoring antigens. So you see that most of our predictions were for insulin, but also some other well-known diabetes antigens like this zinc transporter 8 or GAD65, which are really well known to be associated with type 1 diabetes. So you see that you can look at individual TCRs that got scores for these antigens, more than 30,000 for insulin, so clearly the top scoring antigen. You can also look at epitope level, where it's this insulin epitope that really is driving the response in most of these. So another way of looking at this is antigen clusters. So these are basically different clusters of TCRs for the different antigens. So see, for example, for pre-pro-insulin, these really nice clusters, in this case, one with 136 TCRs for this, and you can see that the view is a little bit different for the different types of antigens, but clearly you have individual clusters of probably epitope specific that are driving clusters that are driving this antigen specific response. So if we take a deeper dive, for example, in the insulin, which was really the top antigens, and you compare all the annotations for the healthy versus the type 1 diabetes data sets, you see that there's really a significant difference here with, again, this top epitope driving the response. So I see that there are 800 TCRs that are specific for this top insulin epitope, this specific sub-analysis. And then one last view I wanted to share is another antigen. So where we look more broadly at this glutamate decarboxylase 65, we also see a significant signal there. And the alternative view here is for some of these clusters, you can see that they are really shared by different patients. So this one is shared by 9 different patients. There are 14 TCRs in this cluster altogether. And so these are all really interesting clusters to take deeper dives in and that really provide an insight in the dynamics, I think, of the response.